A very good morning to all. So I'm Dr. Ishaan Arora, Chief Resident in Department of Radiology from MJ Medical College, Chhatrapati Sambhajinagar. So topic for my paper presentation today would be vascular and anatomical variants of abdominal vessels on computed tomography with its clinical significance. Coming to introduction, it is quite common in general population and evaluation of these arteries arising from the abdominal aorta and its variation is very important for minimally invasive or laparoscopic surgery as well as for abdominal disorders. The use of contrast plays a very crucial role in various assessment of vascular anatomy. It helps in pre-operative evaluation to plan laparoscopic surgeries or complex hepatic procedures or limited visualization during the surgeries. It also helps to avoid various intraoperative problems that may arise due to rare variants. Aim of my study is to evaluate different vascular variants on CT, its prevalence, and its clinical significance. So it was a time-bound study, time-bound observational study, and it was done over a duration of 4 months from Jan to April 2025. I included total 70 patients, and it was done on a 128 slice CT scan after contrast administration, and the contrast used was iodinated contrast, urographin more specifically. The patients I included all the patients that were referred to our department for CT scan, contrast enhanced CT of abdomen pelvis, and I excluded all the patients who had non-contrast CT and the patient who had creatinine more than 1.6. So result of my study was in total of 70 patients of my study, 27 patients had vascular variations. So, and out of 27 patients, this is a pie chart showing the most common being the renal artery variation, 17%, followed by hepatic artery, then celiac trunk, then portal vein, then nutcracker syndrome. So the most common among being all the five, renal artery and hepatic artery. Renal artery, out of all 12 patients among the renal artery variation, 9 patients had unilateral accessory artery, whereas 3 had bilateral. In hepatic artery, total 8 patients showed hepatic artery variation, out of which 6 patients had replaced right hepatic artery with origin from superior mesenteric artery, whereas 2 had common hepatic artery with origin from superior mesenteric artery. Coming to renal artery variation, it is the most common accessory renal artery. Out of 27, 12 patients shows accessory renal artery. Out of these 12 patients, 9 patients showed unilateral accessory renal artery, whereas 3 showed bilateral accessory renal artery. This is an image showing unilateral. This is a coronal MIP image showing unilateral accessory renal artery. This is a reformatted image showing the same thing. There may also be seen inferior polar accessory artery, which is an important variation. It might cause extrinsic compression of ureter, which may lead to hydronephrosis, and also its ligation during any intervention can lead to ischemic damage. This is a coronal image showing bilateral accessory renal artery, whereas this is a reformatted image showing bilateral accessory renal artery. Coming to hepatic artery variations, it was seen in 8 cases out of 27 cases. In this out of 8 cases, 6 patients had replaced right hepatic artery with origin from superior mesenteric artery, whereas 2 patients showed common hepatic artery origin from superior mesenteric artery. This is a normal anatomical diagram showing the celiac trunk with all the branches. This is the coronal MIP image of CT abdopelvis arterial phase showing hepatic artery directly originating from the abdominal aorta. Other variations include replaced left hepatic artery with origin from left gastric artery, accessory right or left hepatic artery, or also common hepatic artery origin from aorta. The most common importance for hepatic artery variation is liver transplant. During the transplantation surgeries, it is very important to know the vascular anatomy. Coming to celiac trunk variation, celiaco-mesenteric trunk was seen in only 3 patients out of 27, so percentage out of it was 4.2%. This is a SAG arterial phase showing celiac trunk variation as celiaco-mesenteric trunk. This is a reformatted image. There are other celiac trunk variations noted in the textbooks, which are splenohepatic trunk, posterior-superior pancreaticoduodenal artery, gastrosplenic trunk, hepatogastric trunk, hepatosplenomesenteric trunk, splenomesenteric trunk. Now coming to portal vein variation. Normally the portal vein divides into right portal vein and left portal vein. Right portal vein further divides into right anterior portal vein and right posterior portal vein. But The variation could be that right posterior portal vein can originate as the first branch of portal vein instead of right portal vein. Right anterior portal vein can also originate from the left portal vein. Absence of portal vein bifurcation can also be seen. The importance, again, same, it is used in liver surgeries or radiological intervention procedure like embolization or donor transplantations. Coming to nutcracker syndrome, it has two types, anterior and posterior. Anterior is the classical one and posterior is the rare one. Anterior, this is the image showing, this is the axial arterial phase CT scan of abdopelvis showing branching of SMA of the aorta. And this is a posterior nutcracker syndrome image, axial CT venous phase showing retroaortic left renal vein, and it is seen compressed between aorta and the vertebra. This may lead to renal venous hypertension, which may result in hematuria in patients. So conclusion of my study is that yes, vascular variation is quite common in population. It is mostly seen involving renal arteries followed by hepatic arteries. The knowledge of these variation is extremely important in preoperative situations to deal how to proceed in OTs. Some variation can lead to vascular diseases, and precise vascular anatomical knowledge is very important for minimally invasive or laparoscopic surgeries. Although for vascular anatomical studies, DSA is the gold, digital subtraction angiography is the gold standard. Since it is invasive, so contrast CT is preferred to study vascular anatomical variation, though all digital subtraction angiography is the gold standard. These are all my references. Thank you so much.